This is Caroline.
Maritess.
Neal.
And this is Laura. Welcome to Med Surg Moments, the AMSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med Surg nurses, just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
Our topic today is how to combat nursing burnout in the post-pandemic era. But before we get started, let's see what's new with everyone. Neal, why don't you start us off?
Glad to be back after a short, brief personal leave from the podcast. I guess to start with some of the roses in my life. I'm about 3/4 of the way done with my master's in nurse education. You know, when there's like 2-3 classes left, you start seeing the light at the end of the tunnel. So it's been a long and winding road. And unfortunately, the thorn is the passing of my brother. It's been a long road with that. But I also see the blessings and opportunities to try to help educate others with their diabetes and dialysis. I truly believe it made me a little bit more compassionate towards my patients and their experiences that they're going through. Just looking forward to getting back into the groove of life.
Neal, we are all so sorry to hear about your brother, but happy to see what it has done for you. And you're going to draw on that experience for a long time to come. But we're with you. We're here whenever you need us. For me, roses and thorns in my life. Like I said on the last podcast, I'm getting ready to start my DNP program in January. All of that is set to go. I've been accepted. I'm about ready to start registering for classes. So I'm extremely excited about that. I'm also excited this week. We are celebrating palliative care at my facility, so I've been involved in some pretty wonderful activities around teaching with that. And my one thorn in my life, just recently, my daughter had a pretty serious car issues in the middle of the highway, big busy highway last week, and that kind of shook me up for a little while. But she is safe. She is fine. Thankfully, everything turned out okay. Her car just stopped in the middle of the highway, and we're blessed that she was able to get some help and get off the road, and her car has been repaired and fixed, and she is on her way. So, big deep breath there. And now I'm just looking forward to the holidays. Maritess, anything going on with you?
So many emotions there because I'm listening to you. Happy, congratulations on your DNP. Yay, that's a huge accomplishment. I want to echo with regards to Neal. I really am very sorry to hear, but I'm so happy to see you and being able to talk about it. I think that's on the way to positivity. And to tag on that, Laura, with the accident as well, trying to put my words into it because my daughter, she's 15 and she doesn't want to drive. She's very scared. I'll be a princess forever. Somebody needs to drive me. That's what she told me. For me, a lot of things are happening. I think the most impactful was that very recently I took the role of the Southeast Florida Nurses Association director. It's such a huge responsibility, but I think for the past many years, I've been very active with Florida Nurses Association. And just the last 3 years, I've been very active with grassroots initiatives, legislative initiatives. The episode that we had with Sarah Delgado, that was my point of, I think I wanted to do it. And so when I heard that the Southeast region director had to step down, and I said, let me call her, ask her what she's doing. You got to know the expectation. And when she shared that this is what you do, this is what's going to happen, the commitment, the time commitment, I volunteer in a lot of things. One of my coworkers told me, you like to work for free. And I said, yeah, that's a goal, to serve the community. And so I had to look into that, but I realized I think I can do it. And so I did submit my consent to serve, and I'm actually doing it at this time. Very honored to be the voice of the nurses of Florida, specifically in the Southeast region. And that would be in the Indian River County, Martin County, Okeechobee County, and St. Lucie County. So such a huge honor. I hope I can do it. So how about you, Caroline? What's new?
Wow, it's great to hear everyone's updates. Again, I echo the sentiments of everyone, Neal, and pass on sincere condolences about your brother. I think being a nurse and the resilience that we develop over the years helps you to turn something very, very sad into a positive. And you've already shared that you've been more empathetic with your patients and teaching them about diabetes and renal failure. There's always a silver lining, no matter how difficult a situation can be. And for me, I really don't have too many thorns this go round, would you believe? Everything is going quite well, staying busy, not so much traveling last month. That was great. From the Rose perspective, yes, my daughter is getting ready to host her first Thanksgiving. She is calling me daily about things that she needs, from dinner plates to napkins. It was quite comical. I was trying to calculate the size of the tablecloth that she's going to need on this 6-foot table. You know, numbers are not my strong point. The other thing, and it kind of ties in with our topic today, I'm the proud co-author of a white paper that has just been published. And if you are connected to me or want to connect to me on LinkedIn, the white paper is there. And the white paper focuses on the importance of recognizing mental health and supporting people through challenges. That was very much a Rose and a proud moment, even if I say so myself. But it segues very nicely into our topic today, how to combat nursing burnout in the post-pandemic era. I chose this topic really because we're only just now seeing the repercussions of 2 years of isolation. And that word has become very different to different people. When we think about isolation, we think about gloves and gowns and patients behind closed doors. But think about our families, our friends who just essentially couldn't get out and do anything for 2 years. Who'd have ever imagined at the beginning of all this in March of 2020, this would have happened? So saying all that to set up some great conversation here, Maritess, what are your thoughts and experiences? You have some stories to share?
This is dear to me. I've been very involved with the rapid response nurses who were taking care of nurses during the COVID time. Now that we are seeing them in the unit, I've also seen the nurses who were helping us with COVID vaccines because they were students. So you can actually see the difference, the effects, what happened to them during the COVID time and now post-COVID. And you're on point with isolation. Isolation and burnout is huge. And I think we as nurses, and I am including myself, we do not acknowledge that we are burned out. We are not acknowledging that we need help. We're not acknowledging that it has put a toll on us because we want to be the best all the time. And I think that's one of the things that we need to start with. Acknowledge that this is what's happening, that we need help, that we are burned out. Because once we identify that, then we can find solutions. And I think for me, one of the solutions is that we need to learn mindfulness techniques. And I think I've shared this so many times in our previous episodes. Meditation, for me, I really want to advocate on that. Journaling is one of the things that we really need to practice. I have many journals before, but for this episode, I think I can share one of the journals that I do, and it's called the GLAD technique. Donald Altman. GLAD technique is you have to identify GLAD that happened within the day. So G primarily is gratitude. What are you thankful for? So you have to journal it, just think about it, but I always find it very helpful that you write, what are you thankful for? Letter L, what have you learned during the day? Because when you learn something, it means that you are enthusiastic, you've been creative throughout the day. A is accomplishment. And this is a sense of finding your value. And then letter D is delight. What made you happy? And I think that's important to identify because when you have identified all these 4 things, it means that there's a purpose, why you're here and why you're doing the work that you do.
Yeah, and I think your words resonate even more at this time of year. on an airplane when they tell you put your oxygen mask on first before you put someone else's on. You've got to help yourself first before you can help someone else. One of my connections on LinkedIn, he's an expert in healthcare burnout and positive leadership. And to quote him, he said, after nearly 10 years in healthcare in 2022, I was completely burnt out. My physical heart and my emotional heart were broken. How do we get back to the new normal? I was probably more mentally burnt out than I was physically because I was trying to support everyone from afar. The educator in me was trying to make sure that everyone had the knowledge that they needed to keep themselves safe. But then after a 12-hour shift, they were going home to people who'd been stuck in the house all day, who were desperate to get out and just socialize with people, and that wasn't happening. So I think the positive attitude and finding good in anything are really two big ones for me. Even in the most darkest of situations, I had a friend's daughter, her apartment in Atlanta burnt to the ground on Sunday night. They left with the clothes on their back. They have nothing. And of course, it impacts everything because it's the worst time of the year, because it's the magical holiday season. So I think we have to really be mindful. We really have to take stock of what we've been through and reflect on that and think about how to move forward in the most positive way possible.
I was also an educator during the pandemic, so I was doing a lot of what you were talking about. We were a group of maybe 8 educators, and we were trying to support a huge hospital with all of their education needs. We were having to teach nurses how to do respiratory treatments and phlebotomy treatments that were usually farmed out to other areas, and they hadn't had this kind of experience. I felt like we were on call 24/7, and we wanted to be because we saw what the nurses were going through on the floor. There were rooms that were taped off. They were putting in filtration systems. There were carts outside of every single room with all of the PPE. The floors were almost scary to go on. And so we felt for these nurses. And so we were doing our best to make everything we could available to them. And it was really hard. My father is probably a good story to share because he was an elderly person who had not an active lifestyle, but he would go out and he would visit with friends. He was going to restaurants, meeting friends. And during the pandemic, he lost all of that. And to see how much he deconditioned just from losing that access, it was very hard on me to see him. And after these 2 years, he is not back to where he was before. Yep. In fact, I think his world has shrunk. And that's very difficult for me as a nurse to see. He's burnt out. He's burnt out from hearing me talk to him about how important it is that he get out and he keep moving, and he doesn't want to do that. So that's hard. And it made me think about the other thing that really weighed on me was all of the misinformation that was out in the world post-pandemic. There's a lot of people that have a lot of feelings about COVID itself and the way we handled COVID and negative thoughts about the medical community in general. And I took that personally. I took that way too personally. And I had to realize I can't control what other people think, what other people say. I had to protect myself from that. So I was always proud that I was a nurse and that I could help people with education and with information from my own experiences. And I had to learn to let me keep that to myself sometimes. It's not always the best idea to speak out in some of those situations. And that was hard. That was hard for me. But I feel like now I've got a better grasp on it. And I'm realizing that self-care for myself is not picking a fight, not trying to cause any discourse, because there's people that can handle it and there's people that can't. So you have to pick your moments. And I had to protect myself.
Great segue there, Laura, about protecting ourselves from negative energy. Just to backtrack to 2020 when everything hit, ironically, ladies were mostly in education. I'm getting new into the education part of nursing. I had just accepted a role as assistant nurse manager, literally starting that Sunday, March 12th, I believe it was, the day of infamy. So here I was. I had been a float nurse before that. I had never thought of management. A manager came and recruited me. The floor was actually an overflow med surg floor, so they didn't have any staff. So I thought, great, I'll pick apart the floors of the hospital I worked at with good nurses from floors that they were unhappy. And you walk in Monday, they're like, well, here, the world's gone sideways. So as you ladies talked about prepping rooms and stuff, I remember kind of going through some of that same activity, but then it was supporting the nurses on the floor because, of course, they had to wait to hire travel nurses to get them in line to be on the front lines. And so a lot of times it was jumping in and taking patient loads and transforming how this is all going to be done. I think compassion fatigue and moral injury, whether it's now in post-COVID times or during COVID, we came to save lives. And sometimes, whether it's by the lack of knowledge of how to treat these patients, sometimes the resources weren't as abundant as we needed them to be, to even now, I came in here to save lives. And you look at your hands and you say, I did this to heal, and it feels like I'm hurting. And I'll say, I feel like currently the way people are coming to the hospital, I still feel more than a medical consumption of our goods. There's been a very emotional attachment that people have lacked for so long. I see so many patients that come from nursing homes or situations where a family lives far away. I'm very blessed. My siblings lived right above and next door to my mom, that someone was there at 73, 4, 5, checking on her daily and getting her out, as you had spoken, as opposed to the people that are nursing homes. And they were doubly locking down nursing homes for no one to visit. And so I feel like now you'll have patients who require your attention, and literally you can tell it's just because they want someone in the room with them because their families were so distant, and even staff at nursing homes were stretched way beyond their limits. I think the thing I do sometimes right now that helps me the most is just to sit still and be with my emotions, because I've felt coming out of work sometimes, wow, nobody was dying. I felt this emotional drain on me of just wanting to be in that room. And so sometimes it's just taking a moment and processing that feeling and realizing no patient should be alone in their moment of need, whether it's emotional, physical, ambulating them to the bathroom, or medically speaking in a code, or they're having an episode of some type.
Yeah, I think you bring up some very valid points. Compassion fatigue definitely goes hand in hand with burnout. When you think about burnout encompassing physical, mental, and emotional behavior, we're there, like you said, to care for patients. And when we get so exhausted, the disengagement is apparent. The I don't care attitude is apparent. And I think when we look at why nurses burn out, I think the pandemic pushed a lot of people over the limit, especially in the population of nurses now over the age of 46. And you couple age and a 12-hour shift and the fear of getting sick, the fear of not being able to care for your patient adequately, the fear of not being able to put your patients before you. It all kind of rolls together, and that's why burnout occurs. And I think that was the tip of the iceberg for a lot of nurses that were thinking, am I going to stick with this for another 5 years and then retire, or am I going to be eligible for retirement? So now I'm going to do that. And for a while there, everyone going into work was not if a patient was going to die, was when a patient's going to die and how many patients are going to die. If you remember the horrendous pictures from New York City and the bodies just stacked up on the street, I mean, that was no exaggeration. And it's just incredible to think for the most respected or trusted profession and a hard-working profession, this is what we had to go through. And so I think if we look for strategies to help overcome burnout, you have to, like I said, think about yourself first. Put on your oxygen mask first of all, before you can take care of anyone else. And the more stressed and overwhelmed you feel, don't ignore those feelings. Reach out to whoever will listen. And this is a moment to remind everyone to check human resources. Do you have employee assistance if you take health insurance, if you have benefits? A lot of hospitals now are providing mental health and wellness visits, remote or in person, at no charge. And as difficult as it is, I would really encourage people to hone in on those services, because you've got to manage your own stress and emotions before you can move forward. And then once you're aware of a situation, that's when you can kind of reach out for help. And there are plenty of people out there that want to help. It's just having the courage to say, hey, I'm struggling here.
I think another thing we have to be mindful of is recognizing when people have these triggers, they don't even realize that they need help. They feel like they're handling everything okay, but something out of nowhere can trigger some feelings of fear. And we can't ignore those feelings. We have to reach out for help. And if you notice somebody that might be acting a little bit differently, Just something as simple as asking, hey, are you okay? Can do wonders for them.
Even instead of asking them if they're okay, go in and get in a cup of coffee for them or a slice of cake or something that'll put a smile on their face, and take the approach of, I see you're having a tough day. This might make you feel a little better. I haven't met anybody that I've done that with that hasn't put a smile on their face. Sometimes they completely break down and burst into tears and they're like, how did you know I was struggling? Because you work with these people so closely that you get to know their ins and outs and the way they work. And a good nurse will always be able to recognize those symptoms.
And to your point, the regular check-in. We need to check in. They probably won't ask for help, but checking in is really very important. It may be just how are you doing? Very specifically, what's the great thing that happened to you today? But I wanted to share my burnout moment. I worked 7 days a week during the pandemic. My husband was working in the ED at that time. I saw the burnout from the nurses, but personally, because I've been covering 7 hospitals at that time as the director of education, one day I was in the car and I started crying. And I didn't know why I'm crying. And then I just took up my notebook, wrote down all my emotions. I was just crying while writing all of it. I still remember that day. I even had my notes in my iPhone and I said, I remember this day, this should never happen again. And that's the first time actually I called for therapy. I never thought that it would happen to me. The fact that I know that I'm a very positive person, I know that I'm always looking for positivity all the time. But then I said, if I don't do this, I probably will do something not right. I had to reach out to my husband. That's my burnout moment. And I asked, how are you? Because he works at the ED, so he's directly taking care of the patients. And he said, you know, the reason why I always go out at the patio every end of the shift and I don't want to talk to anyone is because I just don't know how to describe my emotions. And we just started crying. We understood what we were talking about. We are a community. There is a community. You just need to reach out to your community. You need to reach out to your support system.
It's a great, great story. And I think maybe you realize it more now, but when you have someone else that you're close to that works in healthcare, you've immediately got a de-stressor right there because they understand what you're talking about. They understand what you're going through. And it was the same with my husband. At the end of the day, even though he was in one end of the country and I was in the other, we could come together on the phone and share common ground because we were both experiencing the impacts of COVID and the burnout that was exacerbated because of everything else on top of the regular work that we were both doing.
Yeah, I wanted to say something about that because we were talking about resiliency and burnout well before COVID. That was a big focus in nursing before COVID even hit. Those problems have not gone away. They're still a part of it. Now we just have this other factor that we have to consider. So it's doubly important that we remember to take care of ourselves in whatever way that looks like, because it can be different for all of us. I don't do journaling like Maritess does, but I make scrapbooks. My husband and I started taking trips and outings, and I started scrapbooking them. So I have pictures. I have things that make me happy. And no one may ever see those books except for me, but when I look at them, they make me smile. So that's what I do for me. So it can be whatever it is. You just have to find what it is that brings you your own joy.
Yeah.
I think that's a hard thing for nurses is to know when we need help. It's like on the floor. We don't realize we need someone to pass a med for us or discharge a patient. And I think it's hard for us as healthcare workers to know I'm not okay. Because so many of the times we shove everything down to get the job done. that we don't sit back, as you said, Maritess, and all of a sudden be like, what am I feeling? Am I feeling helpless and hopeless? Am I feeling frustrated, annoyed, angry? It's a very hard thing to do, is ask for help, let alone deal with your own stuff. Because as nurses, we hit that badge and boom, we're Wonder Woman, Superman, just taking on the world's problems. And I think that's a bad thing we do as a whole, even prior to COVID, of just not really realizing, like, seeing all the changes in life and death in front of someone's own two eyes for a 12-hour shift. And then you inflate those numbers with the pandemic, and it's just catastrophic. And so, just taking that time. Like I said, I'm not a journaler either. I'm more a talker, but then having someone that you can truly talk to. And someone used to say to me a long time ago, medicine should marry medicine. And sometimes I feel like that's so true. It's like, I'm not saying we're these angels, but it's hard for someone who number crunches all day to understand the seeing of life and death in front of your face just go by so quick.
Indeed. The great comments and thoughts there, Neal. Real quickly, everyone, what do you do? One thing that you do to de-stress outside of work. What can you share with our listeners today? Music is my therapy. Any kind of music, especially with headphones. I felt like I retreat into my own little world with music.
For me, it's books.
And for me, it's karaoke.
For me, it's walking and petting my dogs. My dog got me through COVID.
There you go. There you go. So 3 tips there for maybe it'll help you all out there. Unbelievably, we're out of time. What a great conversation. Before we go, let's summarize what we've learned today. And certainly the first step to overcoming burnout is to acknowledge if you're feeling burned out. It's okay to not be okay. That can be the hardest step. Meditation, journaling, and other mindfulness techniques are really the key to releasing those feelings and emotions. Try the GLAD technique, reflecting on moments of gratitude, learning, accomplishment, and delight every day. We can all do that for sure. Remember, you cannot control what other people think or say, but you can protect yourself. And sometimes you just need some time alone to sit by yourself and be with your emotions. And you cannot take care of anyone else unless you take care of yourself first of all. And if you see a colleague struggling, a tiny act of kindness goes a long way, such as buying them a cup of coffee, bringing some cheer to them. Thanks for joining us, everyone. We will see you next time.
We look forward to connecting with you on the next episode of Med Surg Moments, the AMSN podcast. In the meantime, we want to hear from you. Send us your questions, topic ideas, and feedback via our official Med Surg Moments email address, amsnpod@amsn.org. That's amsnpod@amsn.org.
I'd also like to remind you to become a member of AMSN or renew your membership at www.amsn.org. You receive lots of cool benefits and perks, such as discounted pricing on the annual convention and continuing education.
We encourage you to help us spread the word and subscribe to the Med Surg Moments podcast via your smartphone podcast app to receive notifications of future episodes. Please be sure to leave us a review and recommend Med Surg Moments wherever you get your podcasts to help us reach even more listeners.
The content within the Med Surg Moments podcast represents the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses. Until next time, I'm Laura.
Neal.
And this is Maritess. And always remember, Med Surg Moments is a moment in our lives, a moment in our Med Surg careers that makes a huge difference.